Good evening. This is All India Radio. I am Valsa Williams and with me is Vaibhav Jyotsna Srivastav with the evening news. The headlines. Centre issues revised guidelines for implementation of national COVID-19 vaccination program. 75% of vaccines to be procured by the government from manufacturers and provided free of cost to states and union territories. 44 crore doses of COVID-19 vaccines to be available by December this year. Over 23 crore 61 lakh vaccine doses administered so far under nationwide vaccination drive. National COVID-19 recovery rate improves to 94.3%. COVID curfew to end completely in all districts of Uttar Pradesh and Bihar from tomorrow. Only night and weekend restrictions to continue. 69 lakh tons of free food grain supplied by FCI to all states and union territories under Pradhan Mantri Garib Kalyan Anna Yojana. Defence Minister Rajnath Singh says motto of Atmanirbhar Bharat Abhiyan is to make in India and make for the world. Centre issues guidelines for development of e-content for children with disabilities. And in French Open tennis, Slovenian Tamara Zidansek reaches women's singles semi-finals. In the wake of COVID-19, we appeal to our listeners not to lower their guard and stay safe and protected by following these 4 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, focus on hand and face hygiene, and get vaccinated. For providing COVID-related information and guidance to people, national helpline numbers 011 2397 8046 and 1075 are operational. And now the news in detail. The central government will procure 75% of the COVID vaccines produced by vaccine manufacturers. Procured vaccines would be provided free of cost to states and union territories. These doses would be administered to all citizens free of cost in government vaccination centres across the country. The Union Health and Family Welfare Ministry today issued revised guidelines for implementation of the national COVID vaccination program. The revised guidelines will come into effect from the 21st of June. Yesterday, Prime Minister Narendra Modi announced that the central government would provide free vaccines to states for all above 18 years of age. In the revised guidelines, it is stated that vaccine doses will be allocated to states and union territories based on criteria such as population, disease burden, and the progress of vaccination. It has been said that wastage of vaccines will affect the allocation negatively. It is advised that information about the availability of vaccines at district and vaccination centres must be made available in the public domain to ensure convenience of citizens. In the revised guidelines, domestic vaccine manufacturers have been given the option to provide vaccines directly to private hospitals. This would be restricted to 25% of their monthly production. States and union territories would aggregate the demand of private hospitals, ensuring equitable distribution between large and small private hospitals. Based on this aggregated demand, the Government of India will facilitate supply of vaccines to the private hospitals. This step would enable the smaller and remote private hospitals to obtain timely supply of vaccines. The price of vaccine doses for private hospitals would be declared by the vaccine manufacturer. Private hospitals can charge up to a maximum of 150 rupees per dose as service charges. State governments will monitor the charged price. The Union Health and Family Welfare Ministry has said use of non-transferable electronic vouchers will be encouraged to promote the spirit of Lok Kalyan. These vouchers can be redeemed at private vaccination centres. This would enable people to financially support vaccination of economically weaker sections at private vaccination centres. The CoWIN platform will continue to provide the facility of pre-booking of vaccination appointments. All government and private vaccination centres would also provide on-site registration facilities to the citizens. It has also been advised to the states to utilize the common service centres and call centres to facilitate prior booking of vaccination appointments. Speaking to reporters, Niti Aayog member Dr. V.K. Paul said that guidelines for the national COVID vaccination program have been revised, keeping in view the demands raised by several states and union territory governments.
12 स्टेट्स ने ये रिक्वेस्ट करी पिछले महीने में कि सेंट्रलाइज प्रोक्योरमेंट पे वापस जाना चाहिए। इसमें 10 चीफ मिनिस्टर्स हैं, एक लेफ्टिनेंट गवर्नर साहब हैं, एक चीफ सेक्रेटरी हैं। स्पेसिफिक रिक्वेस्ट केम दैट वी शुड गो बैक टू सेंट्रलाइज प्रोक्योरमेंट एंड देन इम्प्लीमेंट द प्रोग्राम इन अ कंसर्टेड वे।
Many states and union territories had conveyed their difficulties in managing the funding, procurement and logistics of vaccines, which impacted the pace of the national COVID vaccination drive.
The government has given fresh order for vaccines to achieve universalization of vaccination. 44 crore doses of COVID-19 vaccines will be available till December this year. Out of this, 25 crore doses of Covishield and 19 crore of Covaxin are to be procured. The Union government has been supporting the efforts of states and union territories for an effective vaccination drive under the whole of government approach since the 16th of January this year. Based on the various representations received by the Union government, the vaccination for all adults above 18 years of age was opened with the onset of liberalized Phase 3 of India's vaccination strategy on May the 1st. With the aim to further universalize the countrywide vaccination drive, all citizens above 18 years of age can receive the COVID-19 vaccine doses free of cost at government health facilities. In an immediate follow-up of the Prime Minister's announcement of these changes in the guidelines of National COVID Vaccination Programme yesterday, the Union Health Ministry has placed an order with the Serum Institute of India for 25 crore doses of Covishield and with Bharat Biotech for 19 crore doses of Covaxin. Additionally, 30% of the advance for procurement of both the COVID vaccines has been released to Serum Institute of India and Bharat Biotech. Niti Aayog member Dr. V.K. Paul today said that all citizens, irrespective of their income status, are entitled to free vaccination. Speaking to reporters, he said the revised vaccination guidelines will come into effect from the 21st of this month. Dr. Paul said the government has placed an order to purchase 25 crore doses of Covishield and 19 crore doses of Covaxin.
So under the new guidelines, जो भारत की धरती पर वैक्सीन बन रहे हैं, उनका 75% जो है वो सेंट्रल गवर्नमेंट विल प्रोक्योर और ये सारा स्टेट्स को फ्री दिया जाएगा। इसकी जो कॉस्ट है वो गवर्नमेंट ऑफ इंडिया बियर करेगी और इनको आगे फ्री एलिजिबल पॉपुलेशन तक मिलेगा थ्रू द गवर्नमेंट वैक्सीनेशन सेंटर्स इन वेरियस स्टेट्स, डिस्ट्रिक्ट, टाउन एंड विलेजेस।
Dr. Paul informed that the government has also placed an order to purchase 30 crore doses of biological ease vaccine, which will be available by September. Dr. Paul said vaccines as priced to private sector hospitals will be decided by vaccine manufacturers. He said states will aggregate demand of the private sector, which means they will oversee how much network of facilities it has and how many doses it requires. AIMS Director Dr. Randeep Guleria said no data, global or Indian, has had any observations of children being affected more. Dr. Guleria allayed fears that there will be serious infection in children in the future.
अभी तक ऐसा कोई डेटा नहीं आया कि वायरस और द न्यू वेरिएंट जहां पे ये दिखाया गया है कि बच्चों में अब ज्यादा सीरियस इन्फेक्शन हो। 60 to 70% जो बच्चे एडमिट हुए थे दे वर दोज विद कोमॉर्बिडिटीज, या तो उनकी इम्यूनिटी कम थी, कुछ ऐसे बच्चे थे जो कीमोथेरेपी पे थे, जो हेल्दी बच्चे थे उनको माइल्ड इलनेस हुआ एंड दे रिकवर्ड विदाउट हॉस्पिटलाइजेशन। इसलिए अभी कोई एविडेंस ऐसा नहीं है कि अगले अगर वेव आएगी तो सीवियर इलनेस बच्चों में करेंगे। और चाहे हम इंडियन डेटा देखें चाहे ग्लोबल डेटा देखें और पार्ट्स ऑफ द वर्ल्ड में वेव चल रहे हैं, लेकिन उसमें अभी तक भी ऐसा कोई डेटा नहीं आया कि बच्चों में ज्यादा सीरियस इन्फेक्शन होती है। So I don't think that we will have any serious infection in the future in children.
Joint Secretary in the Health Ministry Love Agrawal said the overall recovery has increased to 94.3%, including both home isolation and medical infrastructure, which is a 6.3% overall decrease in positivity from the 1st to the 7th of June.
पिछले कुछ दिनों में जो हमने केसेस की एक स्पीड देखी उसको अगर हम कंपेयर करें तो अब हम पाते हैं कि देयर इज अ कंटिन्यूड एंड शार्प डिक्लाइन इन टर्म्स ऑफ डेली न्यू केसेस जो कि अब देश में रिपोर्ट हो रहे हैं, पिछले 24 घंटे में 86,498 केसेस देश में रिपोर्ट हुए हैं। यह 3 अप्रैल के बाद देश में अब तक रिपोर्ट हुए डेली बेसिस पर सबसे कम केसेस हैं और जो हाईएस्ट पीक देश में नोट की गई है उससे कंपेयर करें तो देखते हैं कि अराउंड 79% डिक्लाइन इन केसेस विद द हाईएस्ट रिपोर्टेड पीक इन डेली न्यू केसेस। यह एक बहुत पॉजिटिव डेवलपमेंट है।
The Union Health Ministry said that the country reported less than 1 lakh daily new cases after 63 days. Recoveries continue to outnumber daily new cases for the 26th consecutive day. The country's active caseload also declined to 13,03,702. 2,123 deaths were reported in the last 24 hours, and with this, the death toll due to the pandemic has gone up to 3,51,309. Meanwhile, under the globe's largest vaccination drive, over 23 crore 61 lakh COVID vaccine doses have been administered so far. The testing capacity has also been ramped up substantially.
Bihar Chief Minister Nitish Kumar has announced unlock with certain restrictions from tomorrow in the state. Night curfew will continue from 7 p.m. to 5 a.m. next morning. Educational and religious places will remain closed. Online teaching will continue in educational institutions. The restrictions will continue till June the 15th. In a tweet, Mr. Kumar said government and private offices will function till 4 p.m. with 50% attendance. According to revised guidelines, all shops and business establishments will open on alternate days till 5 p.m. every day. Only 20 persons will be allowed in marriage and funeral processions. Government and private functions at common places have been prohibited. COVID curfew will end completely in all districts of Uttar Pradesh tomorrow. Only night curfew and weekend COVID curfew will continue after that. New COVID cases are decreasing day by day, and now there are less than 14,000 active COVID cases in the state. More from our Lucknow correspondent.
Today, only 3 districts are having COVID curfew, which includes state capital Lucknow, Meerut and Gorakhpur. And as per government's data, total COVID cases have come down below 600 in these districts. So from tomorrow, Corona curfew will also end in these districts. Now, active COVID cases in all districts of the state are less than 600, and there will be no restrictions in day from tomorrow. Shops will open from 7 a.m. in the morning till 7 p.m. in the evening in all districts of the state. But night curfew will continue from 7 p.m. in the evening to 7 a.m. in the morning, and weekend COVID curfew will also continue. A state with 25 crore population is now having less than 14,000 active COVID cases. Despite of conducting 2,85,000 COVID tests today, the new COVID cases found in the state are just 797. Sushil Chandra Tiwari, AIR News, Lucknow.
Niti Aayog and Piramal Foundation today launched Surakshit Hum Surakshit Tum Abhiyan in 112 aspirational districts to assist district administrations in providing home care support to COVID-19 patients who are asymptomatic or have mild symptoms. The campaign will provide COVID home care support to 20 lakh citizens. The Abhiyan is being a part of a special initiative in which local leaders, civil societies and volunteers work with district administrations to address emerging problems across key focus areas of the Aspirational Districts program. The campaign will be led by district magistrates in partnership with over 1,000 local NGOs, which will enlist and train over 1 lakh volunteers to connect with patients through inbound and outbound calls. Piramal Foundation will work with district magistrates to support the training of NGOs and volunteers. Launching the campaign, Niti Aayog CEO Amitabh Kant said, Surakshit Hum Surakshit Tum Abhiyan is a significant initiative, and it will provide long-term support to India's poorest communities in the aspirational districts by addressing the lasting impact of COVID-19.
Minister of State in PMO, Dr. Jitendra Singh, has instructed for immediate release of pension to the family of a government employee who loses her or his life due to COVID-19 infection. The Department of Pension and Pensioners' Welfare has instructed all ministries, departments, Controller General of Accounts as well as CMDs of pension disbursing banks to ensure that the family pension is started within 1 month of the receipt of the claim from the eligible family member of a government servant. Dr. Singh said all secretaries have been asked to personally monitor the in-service death cases and ensure the start of family pension within a month of the receipt of claim and death certificate on a periodic basis. The secretary should also nominate an officer of the respective ministry and department whose name and contact details shall be reflected on the website for any family member to contact in case of delay. The railways have delivered more than 27,600 tons of liquid medical oxygen LMO to 15 states across the country. Oxygen expresses had started their deliveries 45 days back on the 24th of April in Maharashtra. The Railway Ministry said Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states and union territories, and so far 392 oxygen expresses have completed their journey. The ministry said oxygen relief by oxygen expresses reached out to 15 states, namely Uttarakhand, Karnataka, Maharashtra, Madhya Pradesh, Andhra Pradesh, Rajasthan, Tamil Nadu, Haryana, Telangana, Punjab, Kerala, Delhi, Uttar Pradesh, Jharkhand and Assam. The Railways is picking up oxygen from places like Hapa, Baroda, Mundra in the west and Rourkela, Durgapur, Tatanagar, Angul in the east and then delivering it to the various states. You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Centre issues revised guidelines for implementation of National COVID-19 vaccination program. 75% of vaccines to be procured by the government from manufacturers and provided free of cost to states and union territories. 44 crore doses of COVID-19 vaccines to be available by December this year. Over 23 crore 61 lakh vaccine doses administered so far under the nationwide vaccination drive. National COVID-19 recovery rate improves to 94.3%. COVID curfew to end completely in all districts of Uttar Pradesh and Bihar from tomorrow. Only night and weekend restrictions to continue. 69 lakh tons of free food grain supplied by FCI to all states and union territories under the Pradhan Mantri Garib Kalyan Ann Yojana. Defence Minister Rajnath Singh says motto of Atmanirbhar Bharat Abhiyan is to make in India and make for the world. Centre issues guidelines for development of e-content for children with disabilities. And in French Open tennis, Slovenian Tamara Zidansek reaches women's singles semi-finals. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
Welcome back to the evening news. The centre has been disseminating awareness of 6 national helpline numbers created for the benefit of citizens during the COVID-19 pandemic. The national helpline of Ministry of Health and Family Welfare for COVID-related queries is 1075. The child helpline number of Ministry of Women and Child Development is 1098. For senior citizens of Delhi, Karnataka, Madhya Pradesh, Rajasthan, Tamil Nadu, Telangana, Uttar Pradesh and Uttarakhand, the helpline number of the Ministry of Social Justice and Empowerment is 14567. The helpline number of National Institute of Mental Health and Neurosciences NIMHANS for psychological support is 08046110007. Ayush COVID-19 counselling helpline number is 14443 and MyGov WhatsApp help desk number is 9013151515. The Union Health Ministry's timely intervention has ensured the mitigation of the effects of the corona pandemic. The ministry has taken several measures to communicate correct and verified information to citizens in an attempt to resolve several queries related to the COVID vaccination program. The centre used all possible mediums to reach out to the people and dispel all related myths. Our correspondent takes a look at one such frequently asked question related to COVID-19 vaccine among pregnant women.
Niti Aayog member and convener of Empowered Group on Vaccination, Dr. V.K. Paul, has said that vaccination should not be given to pregnant women. He said that a decision recommending vaccination to pregnant women could not be taken by doctors and the scientific community based on available data from the vaccine trials. Dr. Paul said government will clarify the situation in a few days based on new scientific inputs. He requested people to be a little more patient, saying that the vaccines have been developed in a very short span of time and pregnant women are not usually included in the initial trials due to safety concerns. AIIMS New Delhi director has said that many countries have begun vaccination for pregnant women. The data regarding Covaxin and Covishield will come soon and expressed hope that in a few days the government will get the full required data and grant approval for vaccinating pregnant women in the country. Saubhagya, AIR News, Delhi.
The Food Corporation of India, FCI, has supplied 69 lakh tons of free food grains to all states and union territories under the Pradhan Mantri Garib Kalyan Anna Yojana. Consumer Affairs Ministry said 13 states and union territories, namely Andhra Pradesh, Arunachal Pradesh, Chandigarh, Goa, Kerala, Lakshadweep, Meghalaya, Mizoram, Nagaland, Puducherry, Punjab, Telangana and Tripura have listed full allocation for May and June this year, while 23 states and union territories have lifted 100% food grains for May allocation. In his address to the nation, Prime Minister Narendra Modi had yesterday conveyed the decision of extension of Pradhan Mantri Garib Kalyan Anna Yojana 3 till Deepavali. Now, more than 80 crore people will continue to get free food grains every month till November this year. Under the scheme, 5 kilogram free food grains per person per month is being distributed to beneficiaries. The Horticulture Department of Karnataka marketed 9.53 lakh metric tons of fruits and vegetables worth about 1,523.34 crore rupees during the lockdown imposed in the second wave from the 29th of April onwards. We have details in this report.
The Horticulture Department of Karnataka is working on war footing to market the produce of farmers during the lockdown imposed in the second wave. Fruits and vegetables are procured from the farmers and are marketed through Horticultural Producers Cooperative Marketing and Processing Society HOPCOMs through their 411 retail stores and 41 mobile vans. Online marketing of the product is functional during the lockdown by the HOPCOMs. Talking to All India Radio News, Rajendra Kataria, Principal Secretary to the Government of Karnataka, explained how the initiative of the government helped farmers in selling their produce during the lockdown.
हमने किसानों को जितने भी जो हमारे होलसेल व्यापारी थे राज्य के और दूसरे राज्यों में उसके साथ जोड़ा उनको और फसल के बारे में कैसे उसको लंबे समय तक रखा जा सके गोदाम के अंदर या उसको ट्रांसपोर्टेशन के दौरान भारत सरकार की संस्थाएं है IIHR, CFTRI या राज्य सरकार की यूनिवर्सिटीज के माध्यम से विभाग के माध्यम से किसानों को जागरूक कराया.
The Horticulture Department also issued crop advisories in consultation with scientists to delay harvest by using various techniques. Diksha Saxena for AIR News, Delhi.
The COVID-19 cases and deaths in Bangladesh showed a sharp increase today as 44 people died and 2,322 fresh corona-positive cases were reported in the country over the last 24 hours. According to the latest bulletin issued by the Directorate General of Health Services of Bangladesh, the death toll due to COVID in Bangladesh has gone up to 12,913, while total infections have crossed 8.15 lakh.
Defence Minister Rajnath Singh has said several procedural reforms undertaken by the government have transformed the defence industry to meet domestic as well as global demand. Addressing a webinar on India-Sweden defence industry cooperation today, Mr. Singh said the motto of Atmanirbhar Bharat Abhiyan is Make in India and Make for the World. He said the campaign envisages the defence sector to play a major role in India's economic growth and focuses on manufacturing cost-effective quality products for India and for the world.
The mission Atmanirbhar Bharat of self-reliant India of Honorable Prime Minister of India, Sri Narendra Modi, is about producing cost-effective quality products and in its core has the motto Make in India and Make for the World.
On the Defence Acquisition Procedure DAP 2020, the Minister said it encourages domestic manufacturing and has provided a strong foundation for India to emerge as the defence manufacturing hub. He highlighted that policy decisions such as FDI liberalization and improved ease of doing businesses are attracting top defense companies of the world and have joint ventures establishments in India. He invited Swedish firms to invest in defense corridors in Uttar Pradesh and Tamil Nadu, saying that they can benefit from the unique incentives being offered by the state governments and the availability of a highly skilled workforce in India. The Union government has issued the guidelines for the development of e-content for children with disabilities. The guidelines state that e-content for children with disabilities should be developed based on 4 principles of robust, perceivable, operable and understandable. It also stressed that e-content must comply with accessibility standards. The Union Education Ministry has said that these guidelines will initiate the creation of high-quality content for digital education to children with special needs.
Under the leadership of Prime Minister Narendra Modi, the National Education Policy 2020 emphasizes on empowering young minds and creating a learning ecosystem that can nurture young learners for future leadership roles. To foster the goal and commemorate India's 75 years of independence, a national scheme, Yuva, Prime Minister's scheme for mentoring young authors, will go a long way in cementing the foundation of these leaders of tomorrow. In a tweet, Mr. Modi said it is an interesting opportunity for youngsters to harness their writing skills and also contribute to India's intellectual discourse. For a country like India, which tops the world chart in the youth population, have a lot of potential ready to be tapped into and utilized for capacity and nation building. With this express intent of mentoring a new generation of young creative writers, there is an imminent requirement to take initiatives at the highest level under the visionary national level flagship program of Ek Bharat Shresth Bharat. Environment, Forest and Climate Change Minister Prakash Javadekar today launched an awareness campaign on single-use plastic 2021 on the occasion of World Ocean Day. Mrs. Javadekar said uncollected plastic waste is a major problem. He said in India 2/3 was getting collected and 1/3 was not getting collected. Mrs. Javadekar said under the plastic waste management rules, there is a mechanism of collection and recycling of plastic. He said after the ban of single-use plastic in the country, the government had also put a ban on plastic waste import. In French Open tennis, Tamara Zidansek from Slovenia has reached the women's singles semi-finals. She defeated Spain's Paula Badosa 7-5, 4-6, 8-6. World number 85 Tamara Zidansek became the first Slovenian woman to reach a Grand Slam semi-final today. Zidansek will face either Elena Rybakina or Anastasia Pavlyuchenkova for a spot in the final. Zidansek had defeated 2009 French Open quarter-finalist Sorana Cristia 7-6, 4-6 to enter the last 8 stage.
Now let us take a look at the weather forecast for tomorrow. The national capital Delhi will have strong surface winds during the daytime. The minimum temperature will be 30 degrees and the maximum will go up to 42 degrees Celsius. Mumbai will have generally cloudy sky with moderate rain. The minimum temperature will be 24 while the maximum is expected to be around 32 degrees. Chennai will see a generally cloudy sky with light rain or drizzle. The temperature will vary between 25 and 37 degrees Celsius. Kolkata will see a generally cloudy sky with moderate rain. Jammu will have a mainly clear sky becoming partly cloudy towards afternoon or evening. Srinagar will have a mainly clear sky becoming partly cloudy skies towards afternoon or evening. Leh will have a mainly clear sky. The minimum and maximum temperature will be between 10 and 25 degrees Celsius. Gilgit will see a mainly clear sky. The temperature will hover between 17 and 39 degrees Celsius. Muzaffarabad will have a mainly clear sky.
Now, before we end the bulletin, the headlines once again. Centre issues revised guidelines for implementation of national COVID-19 vaccination program. 75% of vaccines to be procured by the government from manufacturers and provided free of cost to states and union territories. 44 crore doses of COVID-19 vaccines to be available by December this year. Over 23 crore 61 lakh vaccine doses administered so far under nationwide vaccination drive. National COVID-19 recovery rate improves to 94.3%. COVID curfew to end completely in all districts of Uttar Pradesh and Bihar from tomorrow. Only night and weekend restrictions to continue. 69 lakh tons of free food grains supplied by FCI to all states and union territories under Pradhan Mantri Garib Kalyan Ann Yojana. Defence Minister Rajnath Singh says motto of Atmanirbhar Bharat Abhiyan is to make in India and make for the world. Centre issues guidelines for development of e-content for children with disabilities, and in French Open tennis, Slovenian Tamara Zidansek reaches women's singles semi-finals. And with that we end the evening news. Good night.